The American Medical Association just came out with a report saying that people that are not compliant, in other words, if they don't take their prescription medications, that they're much more likely to end up in the hospital and to die. So what do you think about this new report?
Well, it's a good point. For people who are really sick, if they don't take their medications, if they're that far gone, that does lead to more hospitalizations and complications and deaths. So you're right, Vicki. Well, the problem that we have here is not just that, though. Because what this article is giving you the idea of is that everybody should take their medicines all the time. And ideally, if you've got a doctor who's well trained in both preventive medicine and in natural approaches to treating things, when they prescribe a medication, it's probably a good idea to take it. But there are a lot of problems with that. We have 400,000 deaths from prescription medications every year.
And I don't think they mentioned that in their report.
They didn't come close to it. And there are about 2 or 3 million hospitalizations for adverse drug reactions that send people to the hospital. So this is not a small thing.
It seems like it's almost equal, the amount of people that end up in the hospital or possibly dying from not taking their prescriptions compared to people that do take their prescriptions that end up in the hospital or have side effects or die from the side effects of their medications.
You just said something really huge that's a study that will probably never be done. Because by proclamation...
No, they don't want the study done.
No, but we don't know the answer either. I mean, everybody just assumes that everything that we do in medicine is going to be good for the patient, and that all the drugs we prescribe and all the technologies are exactly what they need. And we don't know that. We don't know if we're doing more good than harm. But it seems like, particularly because of the research statements that come out, and because of what people believe in the AMA and they believe in their doctors, they're sure that we couldn't all be making a big mistake. Well, we don't know that.
But by the AMA coming out with this general statement, it seems like maybe they have some connection with the pharmaceutical industry.
I have no doubt that there is a financial relationship with the AMA. They fund a lot of medical education. AMA is in the midst of that as well. And what other conflicts of interest are there are for us just to guess at this point in time, because they haven't come out and said anything. But it would be naive to think that there's not some kind of connection there. Money talks. And yet at the same time, when people are sick, you don't want to underplay this, because about 75% of people don't always take their medicines when they're sick. And about a third of people who have prescriptions that are given to them by doctors don't take them. And about 75% of all the healthcare dollars that we consume in this country are in chronic diseases where these prescriptions are being written.
Well, maybe we should talk about some of the conditions where it really is important for people to take their medications. Like, for example, if they have a life-threatening infection.
Sure, or if you're having a heart attack or a stroke, or you've had some kind of gastric ulcer perforate, or any kind of a disease that puts you in the hospital. Usually there's something pretty advanced about what your condition is, and the medicines that we use in that setting often can be life-saving. I mean, I spent 35 years practicing ICU, CCU, and just general medicine.
Somebody's in heart failure, they need medication.
Somebody comes in pulmonary edema because they're in congestive heart failure. You don't give them the Lasix and the morphine and all the things that we do to get them out of heart failure. Most of those people would die, I'm sure.
But then what are some of the instances where people are taking medications that they don't need? Like recently we were talking about a new study that had come out a week or so ago about statins and some of the dangerous side effects that those can have. And many times people are prescribed a statin drug when they're perfectly healthy, and it's ordered prophylactically.
Yeah, we call that primary prevention. And the idea is that if you take the statin prior to having a heart attack or a stroke or some other vascular problem, that it may save a lot in terms of morbidity and mortality and in cost. But in actuality, the data that's out there doesn't verify that at all. So there are conditions like that. There are conditions like hypertension, where we way overtreat because we don't measure blood pressure in an accurate sort of way. We might just take a blood pressure once in the office.
Have a white coat syndrome.
Exactly.
And they're nervous and their blood pressure goes up.
Yeah, and later in the week we're going to talk about that on one of the Fast Track shows. So there are definitely situations where medicines are not the best choice. And then again, when you look at the numbers, 400,000 deaths, 3 million hospitalizations, you're looking at the range of $200 to $300 billion in expense to pay for those errors. And yet the AMA came up with a number of $300 billion being lost because people didn't take their medications as they were directed.
So it sounds like it comes out almost even.
Well, so that's why I'm saying we need a study to answer this. And often what we do is we just get into a big name-calling argument where people who are in mainstream medicine say you should take the drugs and that's the end of it. And the people who are in alternative and complementary kinds of medicine are saying, but you don't understand how much damage you're causing from these drugs. And there won't be a study probably, because how ethical would it be? From both sides, it would be very interesting to see what a study like that would show. So
what are like some of the reasons why people would not take their medications, though, when they're
that's
when
right.
their prescription?
That's a really good point. There are, I mean, most people that don't take them either don't have the money, and that's a common thing. Medicines are terribly expensive. Even Medicare prescriptions have a big donut hole where there's about a $1,200 or $1,500 expense in the middle of that reimbursement program, where patients have to come up with cash themselves, and they just don't have it, so they don't do it.
Or maybe they really do listen to the direct-to-consumer ads.
And listen to the side effects or behind the violin playing. Yeah, that's right.
Or maybe they listen to us.
Well, that's right. I mean, these are all factors that need to be worked out in kind of an objective way, but when we put economics, return on investment, ahead of trying to be transparent with what we're doing and trying to do the best thing to provide the best service for people, that's where things get mixed up. We need to really be clear about our studies. We need our research to be honest. We don't want to see seeding studies where advertising departments are putting money out or studies to try and just advertise a drug to doctors and take advantage of patients and the investigators who don't know what's happening.
It's not a real
with that
study.
It's not really a study that's done to show that there's some new scientific finding. So we have to evolve as a humanity and to really be interested in helping rather than just be worried about money.
But we're not trying to tell you not to take your prescription.
No,
you need to discuss this with your own healthcare practitioner.
For sure.
But it's good for you to be prepared with information so that you can have that intelligent conversation with your healthcare practitioner.
Well, the problem is finding a doctor who will understand this, because we get trained. We think of a disease or a symptom, and we think of a drug or some technology to solve the problem. And while that has its advantages, it can be life-saving, it also imposes treatments that are sometimes invasive and lethal.
Well, also the doctors are listening to the American Medical Association. That's the AMA. They're listening and believing it. And who wrote this article? What journal was this in?
Well, it was in WebMD,
I think.
And who supports them? Big Pharma. So there's, again, an incestuous relationship. And I'm sorry to say this, but the WebMD people are writing a lot of things from time to time that show a slant. And that's why articles like this get published. So,
well, they're owned by Big Pharma, so there you go.
Well, they're not owned by Big Pharma, but that's where they get their income from. That's where the bulk of their income develops. Well, it's about the same thing. You're right. So as we look at this topic objectively, should you take your medicine? Work that out with your doctor. If you have a serious chronic illness, I think you're better off doing that, maybe getting a second or even a third opinion, and maybe an opinion from a specialist who knows the field well.
Maybe look into lifestyle or alternatives.
And if you don't have a serious illness, there are plenty of other ways to manage almost every illness that's out there. So with the combination of things and doing an integrative approach, chances are you'll be able to solve things better than just take all the medicines that your doctor prescribes.